issues. We'll take a break and do our public comment at 12 since that's what we've got, but let's see what we can get done before that time. Mr. Manager?
Yes, Mayor, as the Health Department works their way down, I do have one announcement. I'd like to extend an invitation to everyone for the annual 9/11 Remembrance Ceremony. This will take place on Tuesday, September 11th at 9 a.m. at Sherill Park. That's over on Shoreline. The Corpus Christi Fire and Police Departments and also the Port of Corpus Christi Police will be taking part in the ceremony. Fire Department's pipes and drums will perform as well as the Police Department's Honor Guard. And we recommend that people come early, about 8:30. Thank you, Mayor. That's all. With that, I turn it over to the Health Department.
All right.
Annette Rodriguez. I'm here to be giving the city performance report for the Health District. Okay, so our mission is to prevent disease and premature deaths and promote healthy lifestyles for all Nueces County residents. The City of Corpus Christi and the County of Nueces are both members of the Health District. The city and county provide resources to operate the Health District, and Dr. Bergen is our local health authority. The Health District currently houses both city and county employees in a city-owned facility. We have the main health district located next to the Greenwood Library, as well as satellite clinics in Robstown and Flower Bluff. We also have a building on Williams Drive that we store our records at, and we also share the front part of that space with the police department. The health district provides a myriad of services, as all of you are aware, to include, but they're not limited to, immunizations, restaurant inspections, swimming pool inspections for public pools, OSF inspections, TB elimination, STD and HIV testing, WIC services, diabetes, health education, wellness initiatives, water testing, biological services, public health emergency preparedness, epidemiological investigations, communicable disease investigation, Zika testing, seafood safety, vital statistics, as well as county animal control and limited vector control services on the county side. The health districts assist thousands of people every day, whether they're assuring that sanitary conditions are maintained for people that enjoy eating out, or assisting individuals in working towards healthier goals, or for families that are needing their children vaccinated for back to school. The picture on the screen shows one of our kiddos waiting to receive their first flu vaccine. CDC recommends that all persons, including pregnant women and infants at the age of 6 months, receive their flu shots annually. If you look at our baseline data, you'll see our budget has been level funded over the years. There is some variation for increased allocations and salaries, and in fiscal year 16-17, from an audit where available grant funding from prior years was requested to be placed in the Health District City General Fund. Staffing has also been fairly level, as well as with some fluctuation in Medicaid and grant-funded positions such as WIC and Zika and NFP and other grants. We have a total of 34 city general fund positions and 24 county general fund positions. The other 60-plus positions are at the Health District are state or federally funded positions. The baseline data for our vital statistics division is fairly consistent. We do expect the number of birth certificates issued to increase next year, as we've talked about in the past, because birth certificates will be made available to everyone, regardless of whether you were born in Nueces County or not, as long as you were born in the state of Texas via the new state system, TexEver. Our clinics, such as immunizations, STD, and TB, actually you've seen some declines here over the year. The state has requested that we help patients find medical homes that can be utilized for complete family care, which is what we've had to work towards and is reflected here. So instead of patients coming into the health district and acting like we're their doctor's office, they actually have their own physician in the community that they go to, and that their medical concerns can be addressed there. I will now go over to the performance indicators. I guess to go up for 1 second, on the food service establishments, 2,674, fairly consistent over the years. About 2,300 of those are city restaurants, and 200 are county restaurants. And then we have about 100 other facilities that we permit that are non-paying entities, such as the school cafeterias, foster homes, daycares, those places. For the performance indicators, our environmental and consumer health inspectors receive complaints, and we strive to respond to these high-priority complaints within 24 hours. And I'll show you the graph here. There is the graph, and the 90% is shown in the black line, and we've met that goal over the 90% over the past year. The next goal that I want to show you is our immunization goal. So, and this is for our children. Our goal is to give 3,000 plus childhood vaccines per year. These vaccines are for preventable diseases such as chickenpox, rubella, measles, mumps, polio, etc. You can see here that we are more actively vaccinating during the months of August and September and October, which includes the back to school and also flu season. And it's actually a cumulative goal of 3,000 for the year, and it's not actually a monthly goal. And we do expect to meet our goal. In conclusion, the health district staff are a group of dedicated and knowledgeable employees that truly care about the health of our citizens and perform many different services in order to try and keep our community healthy. I stand by if you have any questions.
Anyone have any questions or comments? You do a great job, and
Thank you, appreciate it.
Ms. Rubio.
Good morning. We got on Channel 6 News this morning, we heard that Houston recorded its first measles child tested positive for measles this morning. And so are we prepared for anything like that to happen here in Corpus Christi?
Well, we hope it doesn't, but
I know.
absolutely.
Yeah.
Yes, and that's one of the pushes that we have for our immunization clinic, is that they make sure that these children all get vaccinated. And we actually do a very good job. It's over 75% of our community is vaccinated. There are going to be some children for religious purposes or for whatever reason they can decline the vaccine, but we also have what we call herd immunity, which means that the more individuals that are vaccinated, they protect the children that are not vaccinated. And so we are prepared. When I first started on board, way back when, almost 20 years ago, we had measles like the first week I started work, and it was like, okay, let's be ready now. And so we had to vaccinate lots of children back then, and the health department was ready then, and they're more so now.
Okay. And then on the question on the, you know, when you have the restaurants, they go in and inspect them, and you have the, I guess, the certificate that says that they've passed and everything's okay. Where is it normally posted?
They have to have the permit, and it's posted where people can actually see it. So sometimes it's behind the register, different places and different restaurants, but it's supposed to be clearly visible so that people know that they are permitted for that year.
Okay.
So it's no longer a pass-fail. We used to do that probably 15 years ago, where they would actually get graded. So we don't do that anymore, but once they've been permitted, then the permit actually has to be visible to the public.
Okay, thank you.
You're welcome.
Any other questions? Well, thank you very much. Keep up the good work.
You're welcome. Thank you.
All right.